Terrence Higgins Trust was founded in the early 1980s in response to the HIV and AIDS epidemic. Since that time, the shape of HIV and AIDS in the UK and around the world has changed massively. There are now therapies that mean that HIV is a long-term condition with which people can live to pretty much normal life expectancy if they're on full treatment. What that means is that the kinds of service provision and support people need have shifted radically. The purpose of the website is to meet that new challenge of the shifted perspective of the epidemic. There are now around 65,000 people in the UK in care in treatment for their HIV. There are another, possibly a quarter as many again, up to about 90,000 in total, living with HIV. About a quarter undiagnosed, don't know they have it. But for those people who do know and are on treatment, there's a growing burden on the NHS in terms of the resource that is required to support those people. And also, as an organisation, we believe that people should be empowered to self-manage their condition as much as possible, that's really a positive direction in which we want to take people. I'm most proud of the fact that we've had a lot of very positive feedback from our service users, and some people have actually said that they love it. The new website enables us to deliver a tailored level of support and information to people beyond our geographical limitations. We have offices across the UK, but these are challenging times, and the website enables us to provide support, information and a whole tailored experience to people completely regardless of their geographical location. I would say the greatest benefits have been that we're now able to meet through one site kinds of diverse needs that we had previously to meet through a multiplicity of microsites. Really, Sitecore enables us to offer a very tailored experience to people who come from a variety of backgrounds. Our key audience groups are African people and gay men. Also a strategic audience are young people, but the site is equally there for anyone living with HIV in the UK. We know that those different groups have very specific needs in terms of how information is most powerfully addressed to them. For example, for an African audience, information is usually most easily or most effectively delivered if it's fairly formal. For the gay male audience, we know that quite colloquial and quite sexualised context can sometimes be the most powerful in terms of effectiveness of getting messages across. That's always posed a challenge for us as an organisation. I would say that Sitecore gives us a tool to achieve that. I would say that at the moment our greatest achievement really has been the number of people that we've had sign up to the site. The whole premise of the site requires that we gather quite a lot of information from service users or from people we work with, and we were always slightly unsure as to whether the number of questions we ask would put people off. In fact, it hasn't. We now have about 1,500 people registered on the site. That figure, in the context of there only being about 65,000 people who know that they have HIV in the UK, so we're talking about 2.5% of the total catchment that we've now got within about 5 months. So I think that that's been a great achievement. I think that it's a very radical new step to apply this kind of personalisation to healthcare provision, and I personally was very new to this whole area and was slightly sceptical about how well it would work. We had several experiences during testing of the site and also from user feedback where I think we've been more than vindicated. We had a service user who was an African man who was very sceptical about the idea of giving us lots of information and us somehow giving him a special version of the site. He wanted to see the big picture. When he saw the tailored version with unique imagery, with special content that was relevant to him, he said, actually, this is like me visiting an African group. And that was our aspiration. This is a personalised experience that, alongside the quality of the information that we provide, which is all accredited through the information standard, also provides a very soft level of support. So it's actually a site that supports as well as informs, and I think that Sitecore enables us to do that. The website also has a couple of community forums, and we've been given permission by a couple of people on the forums to use a couple of quotes from them. I've been hankering after a forum such as this that's totally UK based. Let's hope it expands into something bigger. I'm on here to learn from you all, i.e. the other members, swap stories and learn, really, because the only way is up, I guess. This is from a middle-aged woman living in London. As far as I'm aware, I've never spoken to anyone who's HIV positive before. It's an enormous blessing that there will be others with first-hand knowledge that can help. Thanks THT for creating it and making me addicted to it. And thank you everyone on here for just being you. I feel really proud that this site and the forums that are attached to it are achieving that kind of impact on our service users. It feels like a great project to have been part of.